guidance on your changes, and if everyone could please mute your lines on the phone and the computer. Over to you, Kim. Thank you.
Okay, could you repeat what the part you said about, I missed it. I wasn't able to understand what you wanted me to address.
The guidance on the temporary changes about alerting licensing inspectors.
Okay, so we've had some questions come in from facilities for various changes that they may be making in response to current situations. For instance, if they are having to move a lot of residents and maybe create an isolation wing, or making changes such as that within the facility that don't necessarily affect their licensure. So for instance, they're not necessarily adding beds, they're just making changes within the facility. We've had a lot of questions related to that, and how do they need to notify us of that? And so what we have said is, if each facility could notify the long-term care supervisor that is over their particular facility, that way we would have this type of information on file as to what changes are being made, because we're, being asked by CMS to collect lots of information, not necessarily regulatory related, but just collection of lots of information. And so we felt that that would be the best way for the facilities to notify us.
Never mind.
Thank you, Kim. I'd like to open it up to see if there are any questions. Okay, thank you, Kim. We hope that you can stay with us for the call in case any other issues come up. Thank you so much. Has Sarah?
I will. Yeah. Oh, I'm sorry. There was one other question that we had come in that may be helpful too. CMS had sent out the self-assessment, the infection control self-assessment that they were asking facilities to complete. I understand that there was a similar questionnaire or a similar self-assessment that was sent out by CDC. And so we had the question of if the facilities could choose which one to complete, or if it mattered. And the information or the guidance that we've received from CMS is that they would prefer if the facilities complete the CMS self-assessment tool that was sent out.
Why? Away from everyone.
Thank you. Any questions on the chat function?
No questions at this point, Dana.
Thank you. Thank you, Kim. Over to you, Sarah, with the Department of Health to talk with us about some lessons learned. Sarah Lineberger with the Department of Health. Kelly Parker.
We hear you, Sarah.
This is Sarah. Can you?
Yeah, go ahead, Sarah. Okay, Kelly Parker, have you joined us?
Hey, Dana, this is Matthew Mary with VHHA.
Oh, yes. Thank you. Are you filling in for Kelly today?
I am.
Thank you so much. Over to you.
Excellent. As most on the call are well aware, based off of the numbers projected this morning, total cases throughout the Commonwealth are over 1,400 cases, with an estimate of 208 hospitalizations and 34 deaths. The spread throughout the Commonwealth is now following the 81 corridor, and still our impacted region case counts are continue to go up in the Northern Virginia, Central Virginia, and Eastern Shore regions. With regards to long-term care, I do want to add that this week, for those of you who are updating your VHAS, Virginia Healthcare and Status and Alerting System accounts, we did add COVID-19 data fields along with ventilator data fields. Big ask, but we appreciate all of your participation thus far. If we could continue to update that information daily by 1 p.m., it would be a huge help as this data collection assists with modeling and so forth. It also gives you all the opportunity to give your healthcare coalitions within each region an opportunity to know what your status, your facility operations, supplies, etc. So I do encourage that you go do the daily updates 7 days a week, and we're here to assist if you need us.
Thank you, Matt. Please mute your lines. And are there any questions in the chat room?
There are not, and I do know that Sarah tried to talk and we couldn't hear her, so we can see if we can try again.
Thank you, Matt. We appreciate it. Over to you, Sarah.
Okay, can you hear me now?
Yes.
Okay, great. Thanks, Matt, for updating everybody on the case count in Virginia. If you all aren't already following along, those numbers are updated daily on the Virginia Department of Health website. It's vdh.virginia.gov/coronavirus. And I wanted to mention that website anyways. We're putting a lot of information there under health professionals. Then there's a section for long-term care and other residential settings. And so previous slide sets and that kind of thing are all there. In addition to increasing case counts, we are now saying that we have statewide community transmission in Virginia. And so that has implications for how we move forward. And I wanted to let you all know we haven't pushed out numbers of outbreaks yet, but we are seeing outbreaks occurring in nursing homes. We're also seeing cases occurring in assisted living facilities. We're seeing healthcare workers getting sick. I know many of you have been dealing with all those scenarios, and we thank you for everything you're doing. We're particularly concerned about skilled nursing facilities because the spread has been very fast in those facilities with severe outcomes. We do think that social distancing capabilities is helping to not have that spread in assisted living facilities, because in assisted living facilities, you all have more private rooms and private apartments, that kind of thing. So we're more worried about the very fast spread in skilled nursing facilities. And Kim mentioned that infection prevention assessment tool, and we're asking for that data back to VDH. And it doesn't matter which version of the survey you use. If you fill out the CMS version, we'll still accept that version back, or the CDC version. We're just trying to look at that data statewide. So one really important thing that all facilities should be doing right now is screening all healthcare personnel at the start of each shift for fever and respiratory symptoms. And obviously, if any staff are ill, to immediately send them home. Another important thing to do is actively screen all residents daily for fever and respiratory symptoms and immediately isolate them if they're symptomatic. And please note that elderly residents may present with atypical symptoms. As you all know, they often might not mount a fever like someone younger and that kind of thing. So symptoms to watch out for in your residents include the following: new or worsening malaise, new dizziness, diarrhea, or sore throat. And so identification of any of those symptoms in addition to fever or respiratory symptoms should prompt isolation and further evaluation for COVID-19. We are getting a lot of questions about PPE. One thing that's important when we're saying that there's now widespread community transmission is that if you have supplies available, CDC recommends universal masking for healthcare personnel. We realize there are shortages of masks, but there are considerations because so much is being brought into facilities that really screening healthcare personnel at the start of each shift and having them wear masks when you can is really important to prevent introduction into your facility. I also just want to highlight that environmental cleaning and disinfection is really, really important. That would be for residents that don't have COVID, residents that do have COVID. If you have specific questions about environmental cleaning, we're happy to answer those. There is a list on the EPA website of approved cleaning products. We are getting questions about laundry and medical waste, and any laundry, food service, medical waste should just be handled in accordance with routine procedures. But really cleaning all surfaces regularly is so important. Hand hygiene can't be stressed enough. Anytime you remove PPE, you should be doing hand hygiene, and not touching your face, like not touching your face cannot be stressed enough either. And I'll stop there, and we're happy to take questions.
Thanks, Sarah. So one question is, in different regions around Virginia, our members are seeing different response from their Department of Health when they have a confirmed positive. So if and I'm sorry, this is Melissa, if our members have a confirmed positive on their campus, will the Department of Health be coming on campus at some point? I know how backlog.
Sure, if you have a confirmed case or a suspect case, you should report immediately to your local health department. However, I agree with you that some variation is occurring in terms of whether or not the health department would come on site. In some regions, that's happening more than others. Certainly, we would want to at least do a phone consultation with your facility, and the health department may come on site, but that's not necessarily occurring. Where we can do remote assistance, we're trying to do that, just to limit the number of people going in and out of facilities.
Okay, thank you. And then all the information that you just shared, where can folks find that?
Sure, CDC has put out a toolkit in the last few days for nursing homes. And so if you haven't already, we'll be linking that from the LeadingAge website. But hold on, if you look up CDC coronavirus toolkit for long-term care, you should be able to find that too.
And we'll include that in our daily update today, Sarah. We'll make sure we get that in our update, as well as the survey that you mentioned was included in our update yesterday, and we'll be going out again today.
Yeah, that's great. I can make sure you have the link to that toolkit.
Melissa, this is Carol Jamerson. I'm sorry I was a little bit late getting on, but are you asking if automatically someone from the health department comes, like without you all making a call, or is the concern just
I'm trying to manage member expectations? So it's helpful to know that not in all cases the Department of Health will come on site, that they will often be able to do remote assistance. So that's just what I was looking for clarification on.
Okay, great. I just wanted to make sure the question wasn't, that communication still needs to occur one way or the other.
Absolutely, absolutely. Thank you. And then another question that has just come in was, as you track cases, are you including in that tracking where folks live? So whether they were in a nursing home or assisted living or independent living part of a community or out in the community?
Yeah, I think it's a good question. We are trying to put together more data to better describe the cases. Obviously, a lot of information is coming in, and the data reporting out will continue to evolve. So we are expecting, for example, weekly reports to start coming out that includes some more information about the cases. And so I can ask if we're going to track community, like residential community versus general population, just so you understand, in a normal world, a lot of the data we're getting on cases is sort of one point in time, and after we get the information, more might happen with that case. Like that case might then be hospitalized, or that case might pass away. So we're trying to figure out how to have data moving forward too, and not just at a point in time. So I guess the best answer I can give you is that the data being reported out will continue to evolve, and we're working hard to try to have like more information around each case.
That's great, Sarah. Thank you. And Dana, that was the last question that came into the chat box.
Okay, great. If you do have any questions related to any of the issues that were raised today, if you could please put those in the chat box now. I did want to say again that if you do have any positive cases in your community, to please let Melissa Andrews know so that we can provide you with all the necessary and needed support. There will be a special message. There will be a special message from the governor we were hoping to share with you this morning. It will be in our update that you received today, so I hope that you'll please take an opportunity to listen to that. Before I make the last announcement, are there any questions in our chat room?
No, I was just yes. So when you initially began the call, Dana, you mentioned something about assisted living and residents, families, etc., but it was cut off by the crazy communication. Do you recall what that was?
Yes, that was related to the governor's message that is directed to nursing homes, assisted living, residents, the staff, and all the residents' families. So please take an opportunity to listen to that message today when you receive your daily update from us.
Yeah, a couple other things have come in. So one of the reasons that I'm asking members to report to me when they have positive cases is so that I can share that information with communities in their area. So Terry, I'll try and do that's one of the purposes of it, is number one, so we can know what they need and how we can best support them. But number two, that we can make sure that the other members in that greater community know, because of the fact that you all share staff oftentimes. So we are doing that. And then a question came in: who is helping our policymakers understand the negative physical and emotional effects long-term? Yep.
I'm sorry, you were cut off.
Oh, the question was, who is helping our policymakers understand the negative physical and emotional effects long-term isolation is having on our residents?
That is something that we are communicating through LeadingAge. If LeadingAge is on the phone and would like to comment on that, but that is something that we are continually making legislators and regulators aware of.
Another question that has come in is, when a patient is on isolation for testing for COVID and they're a hospice patient, are communities allowing families to visit? And based on the guidance that came out, it is if that patient is end of life, not if they are on long-term hospice. So if the medical director and doctor have determined that they are actively dying, I guess is the best way to say it, then communities are allowing families to visit and supplying them with the appropriate PPE. Is that accurate, Dana, based on what we learned from Molly?
Yes.
Are there any other questions? None in the chat box, right?
Okay, well, our next weekly call will be on April 8th at 11 a.m. Please do not hesitate to contact us. We're here for you in any way that we can help you. Please reach out to myself or Melissa, and we will stay connected with you all through our daily updates and look forward to speaking with you again on April 8th. Thank you to everyone.